Good afternoon. The Office of the National Coordinator for Health Information Technology is hosting today an information session for the Health Informatics and Technology Workforce Development Program, also known as the PHIT Workforce Development Program. We want to start today's presentation with a welcome address from our fearless leader, Mickey Tripathi, who's the National Coordinator for the National Coordinator for Health IT.
Great. Thanks, Yolanda, and thanks for calling me fearless. Hi, everyone. Good afternoon. I'm Mickey Tripathi, National Coordinator for Health Information Technology, and thank you for attending today's informational session on our PHIT Workforce Development Program. We're just, so excited about kicking this off, and so glad that you're able to participate. As I think about the PHIT program, it's got three things about it that are just fundamentally important aspects of what we want to do and our sort of core values for for the country, I think, going forward. One is building back better. We're obviously still recovering from from a devastating pandemic and the national crisis, and this program is designed to help to address how we come back better, how we sort of reach out and start to get educational programs and start to pull people through into opportunities that are much needed by the country. Second thing that I think it addresses, which is hugely important as well, is equity, health equity, social equity, being able to reach out to parts of our community that have been underserved and underrepresented in key areas. And the focus that we have with respect to helping minority serving institutions and others to be able to create pathways is an important part, a fundamentally important part of the program. Last thing that I would point to that that's incredibly important, I think, and fundamental is the building of our public health infrastructure. As lots of us saw, there were many gaps that unfortunately got highlighted in our public health infrastructure as we were faced with a unique and devastating pandemic. And one of the things this program is designed to address is some of those gaps, which is to say, how do we have capacity building down at the the local and state public health infrastructure level, so we have that capacity, we have that expertise that can start to come in and start to really fill out that workforce and fill out that expertise, so that we have more available capacity across the country to be able to have the public health infrastructure that everyone living in the United States deserves. So I couldn't be more excited, as I said, about kicking this off, and I'm not going to turn it back to the team to kick off the informational session. Thank you so much.
Thank you, Mickey. We appreciate that. Let's get into some background information about this exciting program that ONC is kicking off. Today's agenda includes an introduction of speakers, housekeeping, summary and background purpose and objectives, the program activities, milestones, and performance activities, funding eligibility, application information, as well as application responsiveness and merit review criteria. There will be an opportunity for questions and FAQs, and also dates to remember. Today's speakers will be myself, Yolanda Thompson, as the moderator, Dr. Maggie Winus, she's the branch chief, the ONC Office of Policy, Ms. Arlene Ramsey, a management analyst, also with the ONC Office of Policy. Just a few housekeeping rules. This webinar is being recorded and will be made publicly available after the session. All phone lines will be muted during the presentation. If you have a question, please enter them into the Q&A box. And note that all questions will be answered and made publicly available every Friday until the application closes. The webinar and FAQs will be made available at the healthit.gov topic ONC funding opportunities, strength and technical advancement and readiness of public health link. If you'd like to ask a question during the presentation, use the Q&A function up in the upper right-hand corner of your presentation. You can ask the question there and it will be collected and responded back in the FAQs. If you have additional questions after this presentation, please direct them to the following email address, which is fitworkforce@hhs.gov. Now I will turn it over to Dr. Linus and Ms. Arlene Ramsey to discuss the summary, background, purpose, and approach.
Thank you, Yolanda. Okay, let's get started. Summary. This Notice of Funding Opportunity, NOFO, announces the opportunity to apply for funding under the Public Health Informatics and Technology PHIT Workforce Development Program. The goal of the PHIT Workforce Development Program is to train at least 4,000 individuals in public health informatics and technology to expand the nation's public health workforce. Background. The PHIT Workforce Development Program is responsive to President Biden's executive order and calls for creating and sustaining a diverse public health workforce so that the nation can better respond to future public health and biological threats. The PHIT Workforce Development Program will be a training program that builds upon ONC's past successful Health IT Workforce Development Program, a $118 million effort established under the Health Information Technology for Economic and Clinical Health Act, the HITECH Act in 2010, which trained 20,000 people. Purpose. ONC anticipates awarding $75 million to train individuals in informatics and technology to increase the number of public health professionals trained with a focus on recruiting participants from minority serving institutions, MSIs. Through a period of performance of 4 years, the PHIT Workforce Development Program will provide selected recipients with funding to expand their existing programs or develop a new program to train at least 4,000 individuals on public health informatics and technology to improve the nation's public health workforce. ONC will provide funding in the form of cooperative agreements to institutions of higher education to establish or expand public health informatics education programs, creating a diverse and inclusive health information technology, IT workforce, with a focus on engaging MSIs. Approach. Consortium. Recipients will be part of a consortium that will develop the program curriculum, recruit and train participants, develop internship opportunities, and assist in career placement at public health agencies, public health focused nonprofits, or public health focused private sector or clinical settings. Community of practice. Recipients will participate in a community of practice, COP, composed of recipients and subject matter experts. Sustainability. It is expected that all recipients will sustain the training program once federal funds cease in order to continue to diversify and grow the public health workforce of the future. Program components. Consortium development. Applicants must identify representatives and organizations expected to be part of their consortium when submitting their application. In addition to the lead applicant entity, participants in the consortium must include, but are not limited to, 1, representatives from state, local, or county health departments, and 2, community-based organizations such as community health centers, rural health clinics, behavioral health providers, and or other local nonprofit/clinical providers. Applications will be accepted from colleges and universities that propose to expand or establish their own programs and or that have entered into arrangements to provide training at or through use of faculty of or courses offered by multiple institutions of higher education. These partnerships may be expressed through a letter of intent between the lead applicant and one or more partner institutions. Each consortium is encouraged to include representatives from health IT organizations with local, state, or national reach, public health organizations, entities with expertise in addressing health disparities, and representatives from organizations who help shape standards or govern implementation of health IT and public health information systems. Applications must include letters describing each consortium member's intent to participate in the PHIT Workforce Development Program. Curricular development. Development of curriculum may build upon the previous ONC Workforce Training Program components and may include some or all of the following subject areas: health equity, data science, including privacy/security, data aspects of outbreak investigation, epidemiology, public health analytics, lab-based and remote diagnostics, public health reporting, for example, immunizations, syndromic surveillance, electronic lab reporting, and electronic case reporting, public health emergency preparedness and response, HL7, fast healthcare interoperability resources, fire basics, vocabularies and terminologies, public policy, and combining multiple data streams, for example, clinical data from electronic health records, lab results, immunizations, demographic area, utilization metrics, claims data, and data from other non-healthcare sources, such as social determinants of health, wastewater, etc., for analytical and exchange purposes. The needs and complexities of local, state, tribal, and territorial public health agencies should be considered in developing curricula. An interdisciplinary approach is preferred. For example, an applicant's proposal may note that the proposed curriculum will focus on informatics, data science, cloud-based information technology, and other technical content alongside core principles of public health management, stakeholder engagement, disaster management, and emergency response. Finally, the curriculum should be culturally responsive and designed in a way that meets the needs of the local healthcare agencies and sets students up for success in the training program and beyond. Training. Once curricula have been created or expanded, recipients will recruit individuals to participate in the program with an emphasis on enrolling underrepresented minorities to grow and diversify the public health workforce. This program aims to recruit new students and prioritizes trainees from each applicant's student population and other sources for recruiting new workers into the public health field. This program may also offer career advancement for a limited number of incumbent public health practitioners and healthcare workers from the community, especially those in local health departments, federally qualified health centers, or community-based organizations who will be able to obtain new, higher-level jobs as a result of this program. Training should focus on undergraduate and graduate programs and can include majors, minors, and certificate programs. And it should embed stackable healthcare industry-relevant credentials when possible. The goal of the PHIT Workforce Development Program as a whole is to train a minimum of 4,000 new public health informatics and technology professionals, and each recipient is required to project the number of individuals the recipient expects to train over the course of the 4-year award period in order for the PHIT Workforce Development Program as a whole to reach and, where possible, exceed that overall goal. Paid internships and placement. Hands-on learning at health departments, public health-focused nonprofits, or private institutions, or clinical provider locations is a required component of this program. Members of each applicant's consortium will be key in identifying internship opportunities for program participants. It is also expected that the recipient will assist with job placement in relevant fields for individuals who have completed the training program. Recipients should rely on their internal resources and policies to include career placement offices, as well as working with their consortium partners, including state and local authorities, to place students who have successfully completed the program. Internships should be paid and stipends are allowable costs. Sustainability. Successful applicants must outline a plan to financially sustain the training/degree/certificate program once federal funds cease. Applicants must also describe how the program will be integrated into the community's long-term plan to support and diversify the public health workforce over time. Community of practice. All recipients will be expected to participate in a community of practice, COB, convened by ONC, where they will be able to learn from each other and share informational resources and best practices. The COP will also include representatives from national health IT organizations, as well as curricular accreditation organizations. Additionally, to ensure a focus on equity, the COP will also include representatives from organizations that prioritize equity in healthcare and public health. The COP will meet monthly during the first year and will continue to meet quarterly throughout the rest of the award period. Moving into performance goals, program monitoring, and program evaluation. Performance goals. The performance goals associated with this NOFO and ensuing award are as follows. Progress on development and finalization of each consortium and how it will address equity and public health informatics needs. Establishing numerical targets for individuals trained and/or who have experienced career growth, program retention and completion, as well as individuals who have assisted with relevant career placement and completing the targets during each year of the period of performance. Assessment of all professionals trained and hired during the project period of performance by way of a survey or other assessment, including the race and ethnicity of each trainee to ensure that this program meets its goal to diversify the public health, informatics, and technology workforce. All information collected will be de-identified and will be solely available for ONC's evaluation purposes. Submit a plan that demonstrates how the recipient will maintain financial sustainability and continuity of the training program once federal funds cease. Recipients will need to provide a plan to track each of the performance goals throughout the 4-year period of performance. Year 1 is consortium development, curriculum development, and participant recruitment. Year 2, training and placement. Year 3, we continue with training and placement. Year 4, training, placement, and transition to sustainability. Program monitoring. ONC project officers in conjunction with the ONC Procurement and Grants Division will monitor on a regular basis progress of each recipient. This monitoring may be by phone, document review, on-site visits, or other meetings, or other appropriate means, such as reviewing progress reports and federal financial reports, FFR 425. Project officers will have substantial involvement with the community of practice, and all recipients are expected to actively participate in that component of the program. ONC project officers will be responsible for requesting authorization for the release of funds for their assigned recipients based on progress towards stated goals. Program evaluation. All recipients will be expected to participate in an external evaluation that will assess the success of the program to increase the number of underrepresented minorities and other individuals who are trained and placed in careers utilizing their newly acquired skills in public health informatics and technology. Recipients are required to cooperate with the ONC-directed national program evaluation. Evaluation criteria can include, but are not limited to, program retention and completion, individuals trained, evaluation of the training, trainee placement in relevant fields, post-program earnings information, and demographic information. And with that, I will hand it over to Maggie Wallace, who will continue on with the presentation. Thank you.
Thank you, Arlene. At this time, we'll be going over the funding, eligibility, and application information. Here are the summary of the key details for the NOFO. This is a cooperative agreement, and the available funding is $75 million. The number of awards that are anticipated to be made are 30. Application due date, August 11th, 2021. Anticipated award date, September 14th, 2021, and the performance period is 4 years. The anticipated start date is September 14th, 2021, and we anticipate the approximate amount of each award will be up to $10 million. Eligible applicants. This funding opportunity is open to accredited colleges and universities with terminal degrees in the United States. Only consortium-based approaches will be considered for this program, and applications must include letters of intent from proposed consortium members. In order to diversify the public health informatics and technology workforce and to increase the number of underrepresented minority professionals, the lead applicant in the consortium should be an MSI with an existing computer science, information science, biomedical technology, public health, health informatics, or similar program. The lead applicant in the consortium should be a historically Black college and university, tribal college and university, Asian American, Native American, Pacific Islander serving institution, or other MSI with an existing computer science, information science, biomedical technology, public health, health informatics, or similar program. Non-HBCU, TCU, HSI, AA, NAP, ISI, or other MSIs may also apply, but must include at least one of these types of institutions as a consortium member. A list of current MSIs is available at the following link. Notice of intent. Application submitted will be funded under the PHIT Workforce NOFO, ARP PHIT 21001. Applicants are strongly encouraged, but not required, to submit a non-binding email notice of intent to apply. This letter needs to be submitted by July 26, 2021 by 11:59 p.m. Eastern Standard Time. In the letter, please identify the name of the applicant organization, city and state in which the applicant organization is located, notice of funding opportunity title and number, and please send the letter to fitworkforce@hhs.gov. Application process. Applicants must submit all material electronically through grants.gov. This process is outlined in the NOFO. For assistance with submitting applications on grants.gov, please contact the grants.gov help desk at support@grants.gov or call 800-518-4726. Have a Dun and Bradstreet Universal Numbering System, or DUNS number. Register in the system for award management at www.sam.gov and allow 5 to 7 business days to process the registration. If you are already registered in SAM and have not renewed your registration in the last 12 months, you must renew your registration. Lastly, ensure the application meets application requirements and page limits. The application package. The application must include a project abstract, which is less or equal to 500 words, a project narrative, no greater than 25 pages, and no limit for the following items: Form SF 424, which is the application for federal assistance, Form SF 424A, budget information for non-construction programs, Form SF 424B, assurances for non-construction programs, Form SF LLL, disclosure of lobbying activities, budget narrative, and letters of support or commitment. Project abstract. All recipients shall include a one-page abstract that is no more than 500 words. The abstract is often distributed to the public in Congress and represents a high-level summary of the project. Applicants should prepare a clear, accurate, concise abstract that can be understood without reference to other parts of the application, and that provides a description of the proposed project, including the project's goals, objectives, overall approach, anticipated outcomes, products, and duration. Again, for the format, not more than 500 words double-spaced, and it should include a project title, applicant name, physical address, contact name, contact phone numbers, email address, and website address if applicable. Project narrative. The project narrative must address the elements articulated in the program description purpose sections of this NOFO. The project narrative must also factor in and align with the performance activities, program milestones, and merit review evaluation criteria presented in the NOFO. The project narrative must be double-spaced, formatted to 8.5 by 11 letter-sized pages, 1 inch or larger margins on all sides, and a Times New Roman or Cambria font size of not less than 11 point. The maximum length allowed for the project narrative is 25 pages. A project narrative that exceeds the 25-page limit will not be reviewed past the requested number of pages. The project narrative must follow the outline provided below and include the information required under each section. These components will be counted as part of the page limit. The suggested lengths of the sections given below are guidelines to help recipients create a balanced document and not mandatory restrictions. Section 1, Understanding of Purpose and Impact, 1 page. Section 2, Approach, Work Plan, and Program Activities, 10 pages. Section 3, Organizational and Technical Capabilities, 4 pages. Section 4, Collaboration, Partnerships, and Subrecipient Management, 5 pages. Section 5, Budget Narrative and Justification, 4 pages. Section 6, Program Sustainability, 1 page. Section 1, Understanding of Purpose and Impact. This section must demonstrate an understanding of the purpose and objectives of the NOFO. It must demonstrate understanding of how the project components, expected outcomes, and results will help reduce long-standing health disparities and inequities exposed by the COVID-19 pandemic. This section must demonstrate the applicant's understanding of the need to strengthen HBCU, TCU, HSI, AANAPISI, or MSI, and other college and university capability to educate and train underrepresented minority individuals in public health informatics and technology in order to strengthen and diversify the public health workforce of the future. Section 2, Approach, Work Plan, and Program Activities. This section must set out the approach, work plan, and program activities. It must reflect requirements in Section A of the NOFO, titled Program Description, particularly the section Approach. This section must demonstrate the applicant's ability to bring together all resources, including leveraging others' existing infrastructure and capabilities required to perform the proposed work within a 4-year timeframe. This section must also include a clear description of the project approach and activities and how the applicant proposes to train and place underrepresented minorities into public health informatics and technology careers. This section must provide a description of activities, consortium building, curriculum development, internship and career placement, and other related necessary activities, e.g. recruitment, outreach, etc., required to achieve a successful project. This section must describe how the project will expand upon and not duplicate existing efforts, and how well the project will leverage existing federal and other investments. Section 3, Organizational and Technical Capabilities. This section must clearly demonstrate that the organizational and personnel capabilities of the applicant support its ability to implement the project. This section must include the following: the organization's overall capabilities relevant to the proposed projects, technical capabilities, a description of qualified key staff, the capabilities of the applicant not included in other portions of the project narrative, such as any current or previous relevant experience and/or the record of the project team in conducting the proposed activities. Where applicable, description of applicants' experience and capabilities to create new modifications or upgrades to existing technical or policy infrastructure to accomplish programmatic goals. Section 4, collaboration, partnerships, and subrecipient management. This section should provide a description of the following: a description of the applicant's experience and ability to successfully collaborate with partner organizations, strength of the letters of intent that demonstrate commitment to participate in the consortium, description of planned efforts to partner with other relevant public and/or private stakeholders that will lead to internships and/or job placements for students, description of how the approach will involve collaboration with those that represent underserved, vulnerable, at-risk, or racial and ethnic minorities and relevant public health or healthcare entities, description of how the applicant will utilize an open, transparent process to engage stakeholders, and lastly, a description of how the applicant, if entering into a sub-award relationship as the prime recipient, addresses the sub-recipient arrangements for meeting the programmatic, administrative, financial, and reporting requirements of the grant, including those necessary to ensure compliance with all applicable federal regulations and policies. Section 5, budget, level of effort, and justification. This section must provide the proposed levels of effort of the project manager, key personnel, and consultants, and describe how they are adequate and appropriate to advance the project in accordance with the timelines. Also must include an explanation of how the proposed budget supports the proposed project and is reasonable to meet the project's needs and is as cost efficient as possible. An outline of the proposed costs that support all project activities and how they support them. And lastly, a description of how the proposed expenditures align with the project plan at a high level. No expenditures are allowed until the start date listed on the Notice of Grant Award or NGA for the approved projects. Section 6, sustainability and/or replicability of proposed project. Potential strategies the applicant may employ to continue training underrepresented minority individuals in order to diversify the public health informatics and technology workforce once federal funds cease. This section must fully describe how the project could be applicable to and/or relevant to other communities, states, and/or territories, and explain how lessons learned, challenges, successes, outcomes will be shared, such as via news articles, journals, presentations, communities of practice, traditional and non-traditional media outlets, etc., with HBCUs, TCUs, HSIs, AANAPI-SIs, or MSIs, and other colleges, universities, state, tribal, local, territorial, and national stakeholders. Budget narrative and budget forms. Complete the following budget forms to document costs of proposed project activities. This should include the budget narrative on how the proposed budget aligns with the applicant's project narrative, the application for federal assistance, Form SF-424, budget information for non-construction programs, Form SF-424A, assurances for non-construction programs, Form SF-424B, disclosure of lobbying activities, Form SF-LLL, and detailed budget instructions that are also provided in the NOFO. Consortium participant letters of intent. Applicants must include letters confirming key collaborative intent to participate in the proposed project. These letters should be written on official letterhead and should provide a brief description of the information, services, and expertise that will be provided to the consortium. At a minimum, the letter must explain the demonstrated commitment to the project and describe how the collaborator will coordinate and collaborate with other members of the consortium to achieve the goals of this program. Consortium members must include but are not limited to representatives from state, local, or county health departments, and 2, community-based organizations such as community health centers, rural health clinics, behavioral health providers, and/or other local nonprofit clinical providers. Lastly, applicants are encouraged to include representatives from health IT organizations with local, state, or national reach, public health organizations, entities with expertise in addressing health disparities, and representatives from organizations who help shape standards or govern implementation of health IT in their consortium. Application, responsiveness, and merit review criteria. The application review process will include the following. All application materials will need to be submitted electronically through grants.gov. Grants.gov then issues an email receipt upon successful submission. Applications are then reviewed for responsiveness and categorized as pass, fail. All applications that pass the review for responsiveness are then forwarded for merit review. Once the merit review is complete, ONC may make an award. Please note that ONC is not obligated to make an award if none of the applications meet the intent of program requirements or if there is a change in funding levels or availability of funds. Next to the application responsiveness criteria. All applicants must meet the following completeness criteria or they will be administratively eliminated and not sent forward for merit review. The applicant must meet the eligibility criteria. The application must be received by the deadline of Wednesday, August 11th at 11:59 p.m. Eastern Time through http://www.grants.gov. The application must contain all required components, such as the program narrative, SF424, etc. The application must meet all formatting and length requirements. The appendices and attachments are not used as a mechanism to exceed page limits of the project narrative. Finally, the merit review criteria. Responsive applications will be forwarded for merit review. Merit review is conducted by experts in their field from academic institutions, nonprofits, and local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. And these are the criteria. Understanding of purpose and impact, 10 points. Approach, work plan, and program activities, 25 points. Organizational and technical capabilities, 25 points. Collaboration, partnerships, and subrecipient management, 25 points. Budget narrative and justification, 10 points. Program sustainability, 5 points. At this time, I will hand it back to Yolanda.
Thank you, Maggie and Arlene. All questions must be submitted in writing, either through the Q&A function during this webinar, or you may email them to fitworkforce@hhs.gov. All questions submitted in the Q&A function will not be answered today. However, they will be made publicly available each Friday until the application closes on August the 11th. And you could submit those questions or see the response to those questions at the healthit.gov website posted here. Thank you for attending. We will remain on the line for an additional 5 minutes to allow you an opportunity to enter your questions into the Q&A function for this webinar. Again, for further information, you can, to see the FIT Workforce NOFO on grants.gov or to apply, go to http://www.grants.gov web grants view. For assistance with submitting applications, contact grants.gov, either their help desk, which is support@grants.gov, or by calling 800-518-4726. This concludes our presentation for today for the PHIT Workforce Program. Just a few dates to remember. We released this notice of funding opportunity on June the 17th. Notices of intent are due July 26th. The application deadline is 11:59 p.m. on August the 11th, and the targeted award date is September the 14th. We will now end this session. Thank you for your attending. And again, if you have additional questions, please send them to the webpage. Have a good afternoon.